after a Labour backbench rebellion and then last week's major U-turn on welfare reform, the government is now going to put those reforms to a vote in Parliament today. The new plans are only going to deliver a fraction of the savings to the UK's ballooning welfare benefits bill.
Last autumn, the OBR forecast that health and disability payments for working-age adults would rise from £48.5 billion to just over £75 billion in 2030.
And we're joined now by Emma Revell from the Centre for Policy Studies, who says the government should have stuck to its guns, gone ahead with those initial plans. Labour MP Rachael Maskell, who believes the government's concessions don't go far enough. And I think in Parliament, I'm right in saying, Debbie Abrahams, who's the chair of the Welfare Committee, she was called in to see senior people in Downing Street to be told about those concessions last week. I think you probably were not called in.
I wasn't called in, no.
But Debbie Abrahams is saying that she's not yet persuaded. So there's still a big problem for the government in Parliament.
Well, I think we saw yesterday in Parliament, as the government were presenting the latest reforms, the whole bill unravelling before us, because the sequencing of the way we're not going to have the report on how people get into work until the autumn, and the Timms review, just announced, will not report for another 16 months, by which time, of course, it will be meaningless what we're voting on today, because much of the bill is about those who will qualify, who won't qualify for PIP. And, of course, we won't know until further down the road. So that's why I've been urging government to pull the bill. Let's pause. Let's get this right. Let's consult with disabled people, not involved at all to date, and ensure that disabled people's voices are at the heart of what Labour does. It's a Labour value. But
you and your constituents, looking at those figures we just showed there, the welfare payments going up so sharply, 48.5 to 75.7, your York constituents will say that's rising too fast.
Well, look, Ed, you know we've had 14 years of chaos in Parliament where the economy has not been brought under control, but also disabled people have not been supported into work. Employers themselves need to make adjustments to help people into work, and yet access to work, the tool which helps disabled people have those adjustments, 16 to 18 weeks wait to even get those adjustments. No employer is going to wait for that.
What's the answer to the question? Do your constituents want to see reforms to stop that big rise?
I want to see reforms. My constituents want to see reforms. I want the dignity for disabled people to work absolutely in the right way, supporting people with their mental health, their physical health. But if they're languishing on NHS waiting lists, if they're working into later life in ill health, which many people are, well, of course, they can't work until the interventions are made. And that's why we need to see real reform in health, social care, as well as in employment, to help people bring that welfare bill down.
So you're going to vote against the government's bill today, but
Correct.
It looks like smaller numbers will, so the reforms will actually pass through Parliament
Well, we
today.
still don't know.
OK.
Many people are saying they're done with reasoned amendments. They're just going to have a straight up and down vote on second reading and reject the reforms. Other people don't know at this point. But, of course, when we're in Parliament, we have to carry the stories of our constituents with us.
OK. Well, let's talk to you, Emma Revell. You're from the Centre for Policy Studies. Do you think that the government should have stuck to its guns, cut the welfare bill in the way that it was originally going to until the U-turn? But I wonder whether you think the government should go even further. Why are we claiming so much in work and disability benefits?
Well, if we look just purely at the cost, the initial reforms that the government outlined were planned to save between £4 and £5 billion by the end of this Parliament. But by the end of this Parliament, the increase in the bill was going to be around £25 billion. So even the reforms as initially outlined were a very small saving on a massive increase to an already substantial bill.
But do you know why that is happening? Are we too sensitive, sympathetic to conditions which people could actually go to work with or continue working through, or should do, without support from the state?
Yeah, so it's a combination of factors. Since COVID, having done away with face-to-face assessments, for example, the bill has risen significantly, and there is a presumption there, I think a reasonable assumption, that people are finding it easier to pass an over-the-phone assessment. There has also been a significant...
OK, but that's interesting. So are you suggesting that if those individuals had a face-to-face assessment, they wouldn't get the benefits they're able to claim over the phone.
I think for some people that is certainly true. For example, the number of people who were withdrawing prior to a face-to-face assessment has collapsed. That almost doesn't happen anymore. And there are a number of assessors who have said, well, we feel like people who were not necessarily eligible to claim wouldn't have passed a face-to-face assessment, would have withdrawn their claim.
So there is evidence that it is simply too generous because people are not being scrutinised properly.
Well, it is easier to pass an over-the-phone assessment. Assessors have said they don't feel like they can assess people properly without being able to see them. Obviously, for a large number of people, they are making these claims in good faith and they are absolutely entitled to the money that they're claiming. But were I the government, I wouldn't have started with the welfare reforms they'd announced today. I would have started with improvements to the assessment process.
Isn't it ironic that, the Centre for Policy Studies, right-of-centre think tank, had a Conservative government for 14 years, George Osborne as Chancellor, cracking down on welfare reform, then a series of Conservative Prime Ministers and Chancellors who presided over this massive increase in the welfare bill. They completely lost control, as you said, of assessment and people claiming. What went wrong?
Well, I think some of it was changes that were reasonable to be made under the pandemic. We weren't able to have face-to-face assessments in the same way, and shifting to phone assessments, for example, made sense then. It doesn't make sense now, and there's no reason that we can't return to that. I think the Conservatives would acknowledge that, this massive increase, we've had 1 in 10 people is on some form of disability or incapacity benefit, and that's gone up, I think, 0.8 million, almost 1 million in the last 4 years. That's a significant jump. That's happened under a Conservative government, and they would acknowledge that.
OK.
These are things that need to be changed and could be done in a less politically contentious way than some of the reforms that the government are doing now.
Rachael, would you acknowledge that changing the way that people assessed might be one way of getting control of this budget?
Completely, and I wouldn't just say that there needs to be in-person assessments. I think clinicians need to be involved. They know about conditions and they know about their patients, and I think they've been cut out of the process for too long, particularly people with fluctuating conditions. And of course, mental health, a very complicated area. We need to support those people on that journey back into work.
OK.
So we need those interventions from the experts as well.
Thank you both very much indeed. The vote is finally, after we've been talking about it and the U-turn was made, the vote is finally later today.
The first vote, and there'll be quite a lot more in the coming weeks and months as this bill goes through.